The COVID-19 pandemic was a global health crisis that reshaped the world in unprecedented ways. Its far-reaching consequences extended beyond the physical toll of the virus, touching nearly every aspect of human life. One of the most significant yet often overlooked impacts has been on mental health, a silent crisis that unfolded alongside the pandemic. As the virus spread, so did a wave of fear, uncertainty, and isolation, creating a perfect storm for mental health challenges. The psychological toll was profound, with many experiencing heightened levels of stress, anxiety, and loneliness. Studies reported significant increases in anxiety, depression, PTSD, and substance abuse, as people struggled to cope with the new reality. Contributing factors ranged from fear of infection and the loss of loved ones, to the economic fallout and prolonged social isolation. For many, the pandemic amplified existing struggles, while others faced mental health challenges for the first time. The pandemic also exposed and worsened existing inequalities in mental health care, leaving vulnerable populations at greater risk. Many struggled to access services as healthcare systems were overwhelmed and resources stretched thin. This surge in demand placed immense pressure on healthcare providers, who were already grappling with the physical demands of the pandemic. The crisis underscored the critical importance of addressing mental health as an integral part of public health strategies. Greater investment in mental health services, research, and prevention is essential to mitigate long-term consequences and build resilience. The pandemic has been a wake-up call, reminding us to prioritize mental health globally and foster a more compassionate, supportive world. The pandemic left an undeniable mark on global mental health, altering the way we live, work, and connect with one another. With rates of anxiety and depression skyrocketing, millions found themselves grappling with emotions they had never experienced before. Fear of infection, economic uncertainty, and social isolation created a perfect storm for mental health challenges. The constant barrage of negative news and the unpredictability of the situation only added to the collective stress. Job loss, financial strain, and the loss of loved ones further fueled this surge. For many, the grief was compounded by the inability to mourn traditionally due to restrictions. Disrupted routines and social connections compounded the impact on well-being. Children struggled with remote learning while adults faced the challenge of balancing work and home life in isolation. Beyond anxiety and depression, conditions like PTSD became more prevalent, especially among frontline workers and those who lost loved ones. The emotional toll on healthcare workers was immense, as they faced relentless pressure and heartbreaking losses daily. Pre-existing mental health conditions often worsened due to increased stress and limited access to care. Many found themselves on long waiting lists for therapy, or unable to afford the help they needed. The pandemic highlighted the fragility of mental health systems and the urgent need for resilience. It underscored the importance of community support, accessible care, and prioritizing mental well-being in times of crisis. Healthcare workers, hailed as heroes, have been at the forefront of the fight against the pandemic, embodying resilience and dedication. Yet, this role came with a disproportionate mental and emotional toll, as they faced unprecedented challenges and personal sacrifices. The unrelenting pressure of working on the front lines, often with limited resources and overwhelming caseloads, and witnessing the virus's devastation firsthand, left lasting scars on their mental health and well-being. Studies revealed alarming rates of burnout, PTSD, and depression among healthcare professionals, highlighting the urgent need for support. Many turned to counseling and peer support, but the road to recovery remains long and complex. Even as the acute phase of the pandemic subsides, countless healthcare workers continue to grapple with long-term mental health effects. The trauma of witnessing immense suffering and loss, coupled with the burden of making life-altering decisions in resource-limited settings, has been profound and deeply impactful. Addressing healthcare workers' mental health is not just crucial for their well-being but also for maintaining a resilient healthcare system. A sustainable future for healthcare depends on fostering a supportive environment where workers feel valued and heard. Comprehensive strategies including accessible mental health services, wellness programs, and stress management initiatives, alongside organizational changes and policy reforms, are essential to ensure their recovery and resilience. Amidst the challenges of the pandemic, some safety measures unexpectedly improved mental well-being for certain groups. Studies found a correlation between adherence to measures like mask wearing and reduced depression symptoms. These measures provided a sense of control and reduced anxiety for some individuals. The pandemic also forced people to slow down, reevaluate priorities, and reconnect with loved ones. Many adopted healthier coping mechanisms, such as mindfulness, exercise, and spending time in nature. Virtual connections fostered a sense of belonging and reduced isolation, despite physical distancing. While not universally experienced, these positive effects offer insights into promoting mental well-being during adversity. The pandemic exposed and significantly worsened existing inequalities in mental health care and outcomes. Lower-income communities and marginalized groups faced greater challenges, from job insecurity to a lack of adequate healthcare access. Minority communities, already experiencing systemic racism, faced increased levels of stress and trauma. These factors collectively contributed to higher rates of mental health conditions among these vulnerable populations. Addressing mental health inequities requires tackling root causes like poverty, systemic discrimination, and healthcare access. The pandemic underscored the interconnectedness of social determinants and overall mental well-being.
Breaking news.
The pandemic brought mental health to the forefront, prompting legislative action in the U.S. Texas prioritized funding for community mental health centers and expanded telehealth services. Efforts to address the shortage of mental health professionals included loan repayment programs and expanded training. School-based mental health programs were introduced to identify and address concerns early. While progress has been made, much work remains to meet Texans' evolving mental health needs. Continued investment in infrastructure, workforce development, and innovative care is essential. These steps are critical for building a resilient and equitable mental health system. The pandemic reminded us of the importance of mental health and its interconnectedness with overall well-being. Increased investment in mental health infrastructure and workforce development is crucial. Expanding access to quality care, especially for underserved communities, must be a priority. Early intervention and prevention programs can mitigate the long-term impact of crises. Addressing social determinants like poverty and discrimination is essential for health equity. The pandemic has been a challenging chapter, but also an opportunity to learn and grow. By prioritizing mental health and addressing systemic inequities, we can build a more compassionate world. 10.